Good morning.
Morning.
Good morning to everybody. A very warm welcome to the esteemed panel speakers and de- delegates to the session, to the 17th edition of CII India Innovation Summit 2021, which is scheduled from yesterday. We had the inaugural ceremony and going on till the 18th of September. The overall theme for the year is crafting our future, innovation for the next world. This conference is aligned throughout our varied speakers from the across the globe, domestic and international speakers. Thus, the timing of the overall program is from 10 to 1 o'clock, followed by the evening, which is from 5 to 8 o'clock. I request all the attendees to maintain the decorum, and in case of any questions, you can post in the chat box and we will take it ahead. We're excited for the session in the morning session for today, which is on healthcare challenges in the post pandemic India. What are the key healthcare challenges facing that India is facing now? The opening remarks for the session will be done by Mr. Ajay Nanamati, Chairman Quantum Advisors and former Chairman Syndicate Bank. Just to give a small introduction about Sir, Mr. Ajay, a seasoned global executive with 35 years of multi country, multi business, cross functional experience. He joined 3M in India in 1986 as his first employee. He was responsible for forming the joint venture, building the organization from the scratch, and launching the IPO. In his subsequent 28 years with 3M, he held positions of increasing responsibility in Singapore, Austin, St. Paul, Israel, before returning to India in
Photo
2006
வேணுமா?
as the first Indian MD of 3M Fully International Public Company. He retired as chairman of Syndicate Bank and is currently chairman Quantum Advisory Services and
வினோத் பாலா கூட
independent
டின்னர்
director
இது கொடுத்துட்டா?
and Alicon Cast Ali Limited. He is an active innovation and corporate governance advocate, an angel investor, and a mentor to startups on leadership development. He's a member of various CII committee, including Corporate Governance, Institute of
அந்த
Quality,
டைம் ஆகுது.
Startup
டெக்ஸ்ட்
Council,
அடிக்குது.
Innovation Summit. He's also an advisory board of the International Institute of Information Technology and the IIMB Israel Center. So over to you, sir. Thank you for joining us.
கான்ஸ்டபிள்.
Thank you, Jolyn, for that overwhelming introduction, most undeserved. But good morning, everybody, ladies and gentlemen, friends. Welcome to the 17th CII India Innovation Summit.
வரும் 2 seconds.
Can I request the others to please mute themselves? Thank you. So the theme of, as Julian mentioned, the theme for the event, I've been associated with this Innovation Summit ever since its inception, and I've seen it grow from strength to strength, and it has now become the premier innovation event in the country. The theme of crafting our future innovation for the next world could not be more timely or relevant for where the world finds itself today. Within this broad theme, this particular session on healthcare is even more compelling as the world is just recovering from the global pandemic and the lessons learned are still fresh. Though the title of the session is Healthcare Challenges in a Post-Pandemic India, I'd say a more appropriate title would be Healthcare Opportunities in a Post-Pandemic India. As the old saying goes, never waste a good crisis. Um, since my own knowledge of this sector is limited to the exposure I've had as a supplier during my 30 years 3M career, I am indeed fortunate to have such an eminent group of speakers representing the leading homegrown service provider in the country, an MNC device manufacturer, and a seasoned administrator practitioner. So we clearly could not expect to have a more diverse and knowledgeable panel that I am fortunate to have the opportunity to introduce. Everyone knows the statistics on India's rankings on various global healthcare indices, such as hospital beds, healthcare spending as a percentage of GDP, patient-doctor ratio, etc. So I will not belabor them. But clearly, the often used adage, about availability, accessibility, and affordability apply in spades. Having myself lived across continents, I've had the opportunity to personally see firsthand other global systems, including Singapore, US, Israel, and India. And I can say without hesitation that our challenges in India are indeed unique. As I mentioned earlier, I'm clearly not an expert on this sector, though I have been associated with in an angel investor capacity in a few healthcare startups. And it is glaringly evident that we are at a significant inflection point. And the key drivers, in my opinion, will be the significant technological advances we are seeing in digital health or medtech, which for a country like India is absolutely, absolutely essential. Before I sign off, I don't want to make this a lengthy conversation from a person who's a layman. I just thought to share a particular initiative that I was involved in. This was a pilot project we at 3M had done some 20 years ago, where we'd actually configured a 20-foot container and in partnership with Cisco and HP, placed this in a remote rural location with a minimally trained aide using 3M's Bluetooth-enabled litmus stethoscope to set up a remote diagnostic capability. And I thought at that time, this was 20 years ago before it became the flavor of the month. At that time, we were unable to take that forward and scale it beyond the pilot, though the results were increasingly very encouraging. So that was my first exposure to having looked at digital health. I apologize, there is a plane taking off from where I am right now. That was my first exposure to digital health. So without any further ado, and not to waste your time hearing a layman's perspective, I will now invite Ms. Shobhana Kamineni, Executive Vice Chairperson, Apollo Hospital Group, to share her expert perspectives. And we couldn't ask for a more seasoned person to provide an in-depth perspective of what we are seeing around us. So, Ms. Kamineni, I would like to hand over to you and request you to please take this forward.
Hey, thank you, Ajay, and good morning to everybody. I've done so many of these pandemic Zoom calls that I know that giving you all this gyan, because I was listening to something the other day from WEF, and I said, oh Lord, I've heard all this stuff before. So I'm challenged to make it a little more interesting first thing in the morning. But one is, I want you to hold the thought that you had about the early medtech that you did 20 years ago. I think that's an important point of where we are in this inflection and what, the possibilities of what we can do. So really, this pandemic, having been on the super crazy side of this, and deep depression and PTSD that all healthcare workers have some form of, I really think that I would not call this as an opportunity, but really it's brought out the importance of being able to do more with a lot less. And it's not just that, I can tell you that when the first wave came, one day, just before lockdown, we had normally about 500,000 people a day visit our 4,500 pharmacies. Suddenly, with this panic, we had 700,000 people, but we had only 50% of our workforce. So I can tell you right there, if I did not have the cloud, and this happened throughout the pandemic, if our systems were not online throughout, we would not have been able to get the supply chain, in place to be able to save the first number of lives. That was the first line. Okay, the first line of defense is to be able to get meds to people who are not critically ill. And I think that in terms of infrastructure, this is something that thankfully the country is ramping up. And this is not just for our business, but supply chains throughout that have been disrupted. Here we are in it. So I'm just jumping straight into examples and issues of what we have and what we need to do. So enhancing the healthcare delivery system is my first point. And I think that we will never be able to have enough beds per ratio, the required ratio that the world says. But what we're looking at now, what we're thinking today is that hospitals don't need that. I mean, healthcare doesn't need the conventional numbers. We have to rewrite those numbers. Now, as technology enables us to be able to give diagnosis over distances, then you can have doctors sitting in areas where, like for instance, Hyderabad has more beds than it actually needs per population. But it's not the case 200 kilometers or 500 kilometers away, or Jharkhand or Chhattisgarh or somewhere in the northeast. But now with technology, during the pandemic, in 45 days, we brought almost 5,000 doctors online. And now they're doing teleconsults, anytime. So you can get a doctor, you can get a specialist consult. And as this happens, many states have adopted in rural areas that you have the CECs, the central systems, that do a lot of the work in terms of land records. They've also built a layer of health into it. So you can go there and get a diagnosis. And now Google, you must have seen that viral video about how they can actually do, a retinal scan. You can do so many things, and this technology is evolving. So I think the healthcare delivery system is actually now one is that it started with them meeting, solving a problem in healthcare that there's not enough. And now what's happening is that the healthcare system itself is revolutionizing to be able to fit this technology and enhance it, work together to take it to another level. So if you see robotics now, we're using it extensively. It's not just in the most complicated surgeries, but it's just the regular surgeries. You can get patients out much. We discharged a total knee replacement in 1 day. And that's because we took everything into their homes, and we're monitoring them through telemedicine. So this is the way that you can, do so much more with so much less. And I think that's what the healthcare delivery of the future will be. It'll be faster, and it will do less with it'll do more with less. And then other thing is that it will be dealing with consumers who are much better informed, that they will be able to get a lot of the diagnostics, a lot of the condition management online. And I think this will help improve outcomes. That it might frustrate the older doctors, but when patients ask questions, it's always a good thing. And I think that it also keeps a lot of the pandemic, that people have realized that they need to take charge of other behaviors, pre-COVID, post-COVID, and I don't think that will reverse. So the healthcare delivery system will definitely be enhanced. Creating a strong medical infrastructure. Who has not lived through the time when they knew someone that needed oxygen in about 5-6 months ago, and all the pictures that we saw, we said everything is breaking down. I do agree that when you're pushed to that limit, there will be certain things that break. But I want us to be able to understand that India, with a 1.3 billion population, actually has better health outcomes than many other countries. In some cases, we handle the second wave better than even the US. So we might have had this deep, these deep cracks in our infrastructure of oxygen. But let me tell you, in terms of the way that we've been able to deliver because of the polio infrastructure, the vaccines, we do have some fundamentally good, or even the government, the PMJY that was saying Ayushman Bharat. Which country can give can give an insurance scheme for 500,000 people? Who can put a COVID app out in a countdown of days? And I think that we do have an awesome infrastructure. We're looking to be able to strengthen it, and I think technology will play a great place in this. And the good thing is that whether you look at state governments or you look at the center, everyone is focused on using technology as a solution to bridge this infrastructure gap. And I think that it will play a great role. It will continue to do so. And with 5G, we're already experimenting what will be the next step in improving infrastructure. So while we might not be able to solve the problems, of the great stress in the future that we might not be able to see, but I would think that would be once in a lifetime event. You're not going to not face oxygen shortage. I'm sorry, you will never face that oxygen shortage again if such a pandemic happened, because the infrastructure filled that gap. But infrastructure, as we look at it in healthcare, is not about filling existing gaps, but being able to look into the future to see what we need to do. And I think having technology will help make that happen. So really quick, my next point is about skilling and training. And I do think that while we have this large cohort of doctors, nurses, technicians, India will also start playing a role for a graying world. So we have to get more nurses out there. We have to get more technicians and definitely more doctors. But more than anything else, we need tools. This is where if we need the Baijus of health to be able to deliver these courses and upgrade skills. So this is something that I would really think that private, public, everybody needs to work. There's a huge opportunity there to be able to get the best qualified doctors and do it using technology. The policy support for a strong healthcare infrastructure system. I'm part of the system, so I'm probably part of the problem. But having said that, I think that everybody knows what it is. It's just that we all look at it from different things. I want something because I'm a private healthcare player, so some of the bureaucracy really kind of frustrates me. But if you look at it from the point of healthcare, and Chris and I sit on a non-profit SWAST, which has been created for that. We look at it from a completely different angle of inclusiveness. So I think that now, if we build the right trust system, if we build the right transparency and a light touch, I do think that the public policy in healthcare will start working well. And with this, I want to give you a pitfall. Some of the things that are happening when, and this is the point in time that technology needs to get it right, and the policies must get it right, whether it's the e-commerce place in how medicines are delivered. I 100% don't think that giving a free consult just to sell a medicine is ethical or right. And I think that the e-commerce players that are driving it that way, or giving deep discounts for healthcare, that means you're taking away from something else. India is the cheapest healthcare. We deliver healthcare at $100 per person. The rest of the world does it in $10,000, $5,000. This is $100 per cap healthcare scenario. And I think that what we should focus on is trust and transparency. So that's something that I think that we as healthcare players should work together to be able to see that it's ethical, keep the doctor's integrity, make sure that we're doing the right things and not cutting corners. And the last part that I want to, leave you with a story that today I just came from an interview. I'm hiring a senior leader in the tech space. This is my new avatar of digitally transforming Apollo into a front-facing. So we started this entire app. And while I was this young guy who we're looking to recruit, he turned around and said, with technology, we don't need the existing healthcare system. We don't need doctors. And then I said, I've heard this before. I've heard a leading tech player say this. And I think that's the problem. We cannot think that technology will solve everything for healthcare. Technology will enable and is taking a greater role. And that's a good thing. But don't ever think that you can replace a doctor's intuition, a doctor's knowledge, or a nurse's compassion, or a technician's ability to actually run that physical test with something that you're doing remotely or using technology. But what we can do and what will be the future of healthcare will be a completely different way that the consumer will be able to trust, look at it transparently, get it from anywhere, anytime. And I think this is the best time to be in healthcare. Thank you.
Yeah. Thank you so much, Ramana, for that very enlightening update. I think the three things that you said that completely resonated with me was that theme about doing more with less. I think that is something that, having spent 30 years with one of the world's most innovative companies, it really drives that whole concept of sort of frugal innovation, that where frugality is going to be that ability to do more with less is going to be the game-changing perspective out here. I think the other thing that you touched upon on skills, which is commonly known, commonly people are aware of. I'm not sure, and I leave this later on for closing comments, as to whether enough is being done to address that. I know in India we tend to beat ourselves up more than we should, and very few appreciate the unique challenges we face. Uh, the two other themes, again, being a non-professional from this space, that really resonate with me, is this whole concept of preventive versus diagnostic. Moving towards more of a preventive mode rather than a post facto sort of a situation. I'm sure you have insights on that. And the other thing that I've noticed with other startups that I'm associated with in the healthcare space is how data and analytics are being used so much more effectively and efficiently now than I ever recall from my days. That whole ability to use data and analytics is such a powerful tool. So once again, thank you so much for your insights, and I really appreciate that.
It's also outcomes. You talked about preventive and this thing. I mean, that
Absolutely.
now everyone is working on outcomes. That's the
That's
word we're using more frequently.
You're so true, because I use that even in the corporate world. Sometimes activity is perceived as progress. Actions are seen as I'm doing something, so I'm doing something. And this is another pet theme of mine about using an outcome-based mindset rather than an activity-based, action-based mindset. Thank you for pointing that out. That was actually on my list of comments. Thank you so much.
Thank you. Thank you.
Thanks, Shobhan. Appreciate. So with that, I'd like to invite Dr. Thomas to share with us his insights. I mean, he's seen the other side of the coin in many ways, both as an administrator and as a practitioner. Dr. Thomas, I'd love to invite you to jump in and share some thoughts and perspectives with us.
Yeah. Thank you, sir, and thank you for having me on the show. Can I share my screen?
Yes, sir.
Yeah, right. So let me start off by saying that health and the global economy, Indian economy, the global economy, are very, very closely related. You can't have one with the other. So it's important that while we revive, while we take care and make sure that we are looking after our people, making sure that we are not that we're containing the pandemic, we also need to ensure that the economy starts recovering. I think recently there was a study by the Tata Institute of Social Science where they said that 240 million Indians have gone into the below poverty line as a result of COVID. And you know what that means. You're talking about poverty which leads to malnutrition, poverty which leads to diseases. So I think it's very, very important that we keep that in mind. Yeah, so let me see if I can share my screen. I'm not able to. While talking about that economy and health go hand in hand, I just want to make a special note about two very important areas which have been a problem. One is mental health. All of important as know that during COVID, there's been a 30% increase in the COVID in mental health disorders in the country. And this again, I think it's understandable because of depression, anxiety, because of job loss, burnout, loneliness. I think it's important that a collective effort by stakeholders should be made to ensure that to some extent we try and sort out this issue. The third one is the impact on education. Here again, I think millions of our students have actually been affected. I was talking to a leading educationist the other day, and she was telling me that normally a 3-year-old student is able to start, a 3-year-old child normally starts talking. But after the COVID pandemic and this lack of face to face interaction, social skills, what has happened is that a 3-year-old is even now talking with in sign language. Yeah, can you see the screen?
Yes, sir.
Are you able to see the screen?
Yes, sir.
Okay, so then let me go to straight to the next. Yeah, thank you. So next.
Sir, I would just request if that
Sir, I
can
would
come in.
request you to kindly put it in full screen, sir. Full screen mode.
I'm trying to do that. There's some issue with able to do it. Okay, while yeah, so I just talked about these three areas. So now we'll go on to what. Yeah, so just a little bit of what HBI has done in relation to these three challenges. We actually came up with a white paper on mental health just before the COVID pandemic. Even at that time, there was a huge shortage of psychiatrists, and we actually had a conference on this, and we were able to send some recommendations to the government. More importantly, we already have a huge shortage of psychiatrists in the country, and we, along with PHFI and the TLLF, that is Deepika Padukone's foundation, we are training GPs and to identify and treat basic disorders. Now, looking again, if you look at the economy, one of the major pillars of the economy is air travel, and we were approached by the airports to come up with a document on safe travel. This was done, presented to the government of India, and in fact, as we speak, some of the recommendations are being implemented. Again, related to the economy, related to schools, some prominent educationists approached us, and along with 30 experts, 30 government school principals, government school headmasters, public health experts, and pediatricians, we have come out with the guidelines for reopening of schools, which will be released in a day or two. Now, if you look at what are the other challenges that we are facing post-COVID and in the future, India has a very large disease burden. And as was mentioned earlier, I think prevention is the key. The move by the government of India to set up these wellness clinics is very welcome. And I think it is important that both government and the private sector get together and ensure that these wellness clinics become functional, that these wellness clinics contribute and serve the population at the grassroots. Also need to start with drinking water and sanitation. And I want to just spend a little time on the introduction of, not the introduction, the use of Ayush. Ayush is known to be a very cost effective measure in wellness and also in disease, more in wellness. And I think this is something that needs to be encouraged in the wellness clinics. We need to also sensitize our allopathic colleagues about the use of Ayush. Again, from HPI, we had a National Health Conclave on non-communicable diseases. The recommendations were given to the government, some of which have been implemented. And we were part of the National Education Policy. And here, if you look, we had an Ayush committee, and we are trying to sensitize our colleagues in allopathy and the general population on how to use Ayush. We're not talking about cross-pathy, we're talking of how to use Ayush per se. Now, coming to infrastructure, I think Shubhana had talked about this. Infrastructure, we know the COVID situation has made us realize that the infrastructure is inadequate. So I think this is tied up to the budget for the government, and the government has promised to increase to 2.5% of the GDP. I think it should go beyond that. And a lot of this should be used to increase the infrastructure. Secondly, I think we also need to encourage private sector to add more beds. And though it has started, I think the government needs to focus on this. I'll spend a little more time on this a little later. Now, one of the problems that it was mentioned earlier that we probably have a huge potential to train human resources. We have a shortage of nurses. We have a shortage of specialists. In some of the government hospitals, the specialist shortage is almost 80%. Another problem which is coming and which will soon be on us, in fact, it is already upon us, is the nurses shortage. A lot of nurses are flying out. I know the NHS has increased the salaries for nurses. Middle East has increased salaries for nurses, and as a result, there's going to be a shortage of nurses in the country. In fact, last weekend I was talking to the CEO of a large group in India, and he told me that the attrition of nurses was 50%. So I think it's important that we need to start thinking about it. So we need to talk about medical reformation on the lines of the NMC. I think the Nursing Council also needs to be reformed, make it easier to produce more nurses, but quality nurses. We have been also need to increase the seats, undergraduate, postgraduate, allied health, nursing, and we also need to focus on quality. Actually, the next in brackets is supposed to be a separate point. This is earn while you learn. I think this is a concept which will do very well in India, and we have proposed this to the government of India that while a person is working in the hospital, that he can train to become an ANM, a GNM, etc. We also need to use the health sector skill council. I think again it was alluded to earlier that skilling is of paramount importance, and we need to focus on that, and also utilize the various open universities in the country. This is something that we had a discussion on, increase in seats. The National Board of Exams have now introduced diploma seats. We were part of the effort. This will go a long way in increasing the specialist capacity in the country. The Health Sector Skill Council is also actively looking at seeing how we can skill the population, the youth of the country. Now, if the next challenge I feel, and this is a collation of information from all our state chapter presidents all over the country. The public health system is a large system, but I think there's a couple of 2 or 3 factors which we need to integrate. One is accountability. We need to ensure that all public hospitals are responsible for what they do, responsible for outcomes. We need to ensure that quality is paramount. There are many institutions in the country, the All India Institute of Medical Sciences, NIMHANS. So there is no reason why a public hospital cannot be as good as a private hospital. And I also feel that the ratio of public to private beds needs to be changed. If you look at today, 70% is the private contribution in beds, 30% is the government, totally diametrically opposite to what was envisaged when we got independence. And if you go to the tertiary level, it's 90% of private beds versus 10% of public beds. And I feel to have a healthy healthcare system, this ratio of the public health needs to at least go to 50%, and ensure that all public health institutions provide quality care with good outcomes. Actually, we are trying to, in a small way, bring in the concept of quality by having these certificate courses on quality. We were able to, all of you have heard of NIMHANS, Institute of Excellence. The HPI was able to be part of the group which helped NIMHANS get full accreditation. So it's not very difficult, it can be done, and I think the government should be encouraged to do this. Much was talked about technology, so I will not spend too much of time on this. All I would try to say is that it goes into every facet of the health professional, right from training to research. So this is something that we need to actively leverage. We need to actively use this to ensure that healthcare is provided to the remotest person in our country. Quality health is provided to the remotest person in our country. Here again, we have tied up with the Indian Institute of Science and ISRO, and we have come up with a course in healthcare technology for medical professionals. Some of the other areas which I think we need to focus on are elder care. India's elder population is increasing, and if you look at today, our culture is changing. My time is up, so I'll go quickly. We need to empower seniors. We need to focus on home health care. And here again, HPI had done some work, and we are just started a new organization called Via Vicos, headed by Chris, and we hope to impact elder care in the country. Climate change is the other very important area which not many people talk about. We have bought a book out on this, and this will be released shortly. Very important, and this is the last point, and I think I'll spend a couple of minutes if I'm permitted. It was mentioned earlier, I think public-private partnership, it needs to be an equal partnership, considering that most of the healthcare is provided by the public partners. There has to be trust and transparency. I think these words are again and again used. I think this is very important. The government has to trust the private and vice versa. There has to be transparency between the government and the private, and between the private hospitals and the patients. And I think financial sustainability is something which needs to be considered by the government. If you look at today, the government decides the cost on a very ad hoc basis. And as insurance goes up, as government schemes goes up, if the scientific rates are not arrived at, the viability of healthcare institutions would be a question mark. I'll just give you a quick example of what we did in Karnataka. We have a very healthy, robust relationship with the government. We were part of the Clinical Establishment Act. We were part of the group which brought in a rule to against violence against doctors with a to make it a non-bailable offence. We were able to empower all the district hospitals in training their doctors to handle pediatric surgery. We were also part of the SDG 3 goal, and very importantly, we were part of the quality accreditation of government hospitals, and a very unique partnership with the government to introduce seats in the district hospitals of Karnataka. And the Karnataka government was recently awarded by the Vice President of India for this this great initiative. We are now working with costing with the Institute of Cost Accounting, and we hope that the government will recognize this, because I think this is what is going to be the basis of what we do in future. This is where the government of Karnataka was being awarded. So with this, let me stop. Thank you very much for this opportunity.
Thank you, Dr. Thomas. Really appreciate the candid perspective that you provided. It's not too often that you get that kind of candor from somebody who is, so I appreciate the openness. I think the two themes that resonated with me amongst the things that you mentioned, three things actually. One was the concept of earn while you learn. I think that was a really interesting, that reminded me, I just saw this movie series recently, Mumbai Diaries, which I know is I don't know if how many of you have seen that. And it was interesting because you saw all these trainees who rose to the occasion when an emergency cropped up. So I think this theme about earn while you learn was one aspect that really resonated with me. And the other one, which again you talked about candidly, which is not too often spoken about, is mental health. And that's another area that I personally am associated with a couple of startups who are doing some very, very cool stuff in that space. Unfortunately, in India, there is still a stigma associated with that. And, I think we need to overcome that stigma that's associated with it. Finally, I think, Dr. Thomas, I'm not sure you touched upon it, but I'm sure that you have deep insight on this. I think again, from a layman's perspective, one of the big issues really is the disparity of healthcare availability, accessibility, and affordability in metros vis-a-vis rural or tier C towns or cities. And I'm not sure that there is an adequate, as I think Shobana also touched upon, that Hyderabad, for example, has a higher number of beds than other places. So there is that mismatch, for lack of a better word, between what's available for us. And I know this because I have a lot of my domestic help who coming from their towns, and we help them in the big cities where we live. So I think that's another area which I'm not sure is necessarily getting adequate attention. We look at it on a broad brush, over a holistic way, but that disparity and that mismatch, I think, is something that also needs to be addressed.
Can I just add, I didn't have enough time, so if there is time, just 2 minutes.
Sure, please. I had this habit of jumping in rather than waiting till the end. So
Okay. Yeah, no, no. I think I didn't mention. One is I think telemedicine has actually revolutionized that, and the situation is far better now than before, thanks to COVID. Second is the government has come in again at our insistence, and they've offered some tax offs to people setting up hospitals in tier two, tier three cities. But the basic issue is the financial viability, and again, it all comes back to costing. So
Yep.
I think that is the second thing. And the third is, if you look at it now, we have been able to increase the postgraduate seats and the undergraduate seats to almost double of what it was 3 years ago. So as a result, what will happen is once the cities become full, our specialists will start going to tier two, tier three cities. It will take time, but it will happen. And I think it's a very, very important point that you brought out.
Thank you, thank you. When I was the chairman of syndicate, our headquarters used to be Manipal, so we used to go for our AGM annual general meetings for my when I was syndicate bank at Manipal. So I did have an opportunity to visit the medical center there, and so clearly there are pockets of excellence. There's some very cool stuff being done, but just to scale it up, I think is going to be the big challenge. So thank you, Dr. Thomas, for your insights. And with that, I will now invite Amit to share with us his perspectives, because I think you guys are also doing some very, very cool stuff in India. I have, and I had done. I know I used to go. I've been to your GE Jack Welch Center here in Bangalore, and I've also got a lot of friends who were in that. So I have a personal association with GE's healthcare model. So I'd love to hear your story, Amit, as to what you see as the challenges and what you as a company are doing to address them.
Thank you, Mr. Nanavati. Thanks for the opportunity. Am I audible?
Yeah, absolutely.
Okay, great. So it was an absolute delight to hear my other co-panelist, and I think I'll just try to add a few things, if not more. But before I go there, at the onset, I just want to take the opportunity to thank CII for inviting G Healthcare to the summit. And the topic is most apt, as Mr. Nanavati also called out at the beginning. Now, we all know India is not only a land of opportunities, but also a land of disparities. And I'm talking about healthcare specifically here. There's a big gap in terms of accessibility, affordability, awareness, and quality of care. These fault lines have kind of come to the forefront in the ongoing pandemic much more in the last 500 days or so. And now it is kind of incumbent on all of us in whatever roles we are in the healthcare sector to collaborate and ensure that we are able to bridge this gap and make health a priority and not let the virus rule our lives. I mean, last 500 days, I heard about mental health, I heard about children's education suffering. I think we all know what kind of havoc it has created in our lives. Realizing the fact that healthcare is a continuum of care and multiple stakeholders are involved at different stages, with everyone's objective is to provide universal, quality, inclusive, timely, patient-centric, and nationally portable healthcare for the well-being of all. So, from the perspective of doing justice to the task at hand, I'll put it this way, not the problem at hand. I mean, the collaborative ecosystem has to be built with the providers, payers, HCP, government bodies, including the regulatory research bodies, industry manufacturing drugs, vaccines. I mean, the list can go on and on. Basically, what I'm saying is that all the stakeholders have their unique role, contribution, and challenges in the overall healthcare value chain. We can help build an ecosystem that is scalable, open, connected, and intelligent, and can be better prepared to tackle those fault lines, what we can possibly foresee today, or what we might be kind of an unanticipated discovery at a later date. In this regard, for accessible and affordable care, I consider both primary care and point of care can address the cost, capacity, and the capability constraints throughout the healthcare value chain by improving the outcomes by right set of interventions and technology innovations. Primary care emphasizes prevention, and point of care emphasizes DBT or the direct benefit transfer. I think the transfer of healthcare benefit directly to the beneficiaries who actually need it is absolutely critical. And I heard Dr. Thomas also talking about it. From the accessible and affordable care perspective, I think it would matter across the entire healthcare, be it in the operating room, ICU, critical care, maternal infant care. I mean, we all know premature and low birth weight babies are born every year, and neonatal mortality can be prevented with basic interventions. The cardiac mortality, the diagnostic cardiology, and then the list can kind of go on and on and on. Additionally, the safety, security, skill upgradation, and I heard Shobna ma'am talking about it, and the burnout of HCPs, patients onboarding, offboarding, scheduling, tracking, staff. Look at the kind of task which an HCP has to intervene in, and the hospital as an institution has to undergo. The inventory, billing, etc. Now, reimbursements and claim settlements from payers, norms, and benchmarks. I mean, if you look at the entire legal framework for regulatory, the technology specifications, funding, the market dynamics, and when I mentioned funding, I was more talking from the startup ecosystem, which is very, very dynamic in India. The market dynamics of the industry are some of the common challenges faced by kind of each of them. Now, healthcare is seeing various themes, but I'll more talk specifically from the digitization themes across the continuum of care, and accordingly, how the digital technology is kind of helping solve these vexing problems. And I think while I agree with Sobna ma'am that technology can't replace a human touch, and it should not. Uh, but at the end of the day, I believe the technology can leverage the human mind and the human touch and help that particular individual to provide a more effective and an efficient care. One of the ongoing themes there is like smart care, virtual care, remote care, connected care. I mean, we can call it anything actually, whatever we might designate them, or even a home-based care. We saw in Wave 2 good amount of home ICUs coming up, and all this has a much wider canvas. I honestly hope that the learnings and the progress made during these times do not take a step back to discount the efficiencies and the efficacies what I talked about earlier. It has brought about to the forefront. Another underlying theme is that of intelligent patient information management and enterprise systems, interlocking with the advent of a smart, intelligent, interoperable medical systems. Today, we have equipments which talk to each other, where the data kind of gets shared and then kind of gets uploaded to a command center, which we at GE call as a clinical cockpit, where a clinician sitting at the same premises or maybe thousands of kilometers away can infer the data. Can then think about what the course of action has to be, and it can be communicated, and then the patient's pain can be addressed. Yet another theme gaining significance has been around EMR and electronic health records, CRMs, practice management systems, hospital information system, e-hospital that can ease the task like registration, appointment, billing, viewing, diagnostic purpose, and we are seeing that. And I'll give you an example. During second wave, we all saw that it touched each one of us. One way or the other, it did touch each one of us. And to confirm one was COVID or not, you needed an RT-PCR report. An RT-PCR report typically took about 3 to 4 days, depending on what cities or what place you were in. The alternative was getting a CT done and getting a CT score done. The good part was while those people who were able to afford CT, they were able to get the CTs, but there's a dearth of radiologists who will ultimately interpret the reports. I feel grateful about the fact that we are in a position to help. GE had a collaboration with a startup, and as a part of our Edison X startup accelerator program called as Predible. And what it did was that we worked with quite a few hospitals where the hospitals were able to upload their CT scans into a cloud, where a radiologist, and that service was like 24/7. A radiologist was able to interpret that report and send it back. And someone sitting at that hospital, a qualified radiologist or someone the hospital could have trusted in terms of the clinical capabilities, would have gone through that report, made minor amendments if required, and the report could have gone to the patient. Now, why I brought it up sounds simple, but during those days, a CT report interpretation could have taken anything from like 6 hours to 24 hours. Here, the turnaround time was like 10 minutes between data uploading and you getting the report back. So that's the kind of effectiveness and efficiency I'm talking about. At GE Healthcare, we do take pride in developing state-of-art, next-generation, standardized protocol, evidence-based. I mean, we look at all the forefronts of technology and see where we can make a difference. So, and predominantly in the healthcare diagnostic technology front, that can help in the affordable care space, that can function as a force multiplier in the primary care and point of care space to expand the access of quality critical care 24/7 to all. And we do believe very, very strongly in precision health. I mean, we more than digital health, we call it as a precision health, because digital has an element of non-human touch there. So instead of digital health, we prefer to call it as a precision health. On the remote monitoring systems, working as virtual care command centers, which we also call as clinical cockpits for our healthcare providers, I think remote monitoring solutions, we all saw what it can do. But what it also can do is, in the normal times, can provide early warning scores for peripheral locations to a central command center for early and accurate interventions. Tele-ICUs, tele-ORs, tele-NICUs are our force multiplier scalable platform based on solution enabling and expanding virtual care by real-time patient monitoring and early intervention protocols. It can also help in forming multiple ICUs. And when I say tele-ICUs and tele-ORs and tele-NICUs, it's not about having one ICU connected to another to a command center somewhere else. One command center theoretically can handle 100 ICUs, and those ICUs can be 8 to 20 beds. It can be in the same building. It can be in a different geographical location altogether. And we are seeing a lot of companies, and including some health institutions, talking about it. In fact, last week I was at NHSRC, and the government is thinking big on NDHM, but they also have this on their plate, and I think government is doing a phenomenal job in terms of the thought process. But only acceleration could help things better. Another thing I think, but this, I mean, our law doesn't really permit that. But globally, we are seeing the advent of a state-of-art handheld ultrasound equipments. I mean, where the scans can happen with a probe, which you can possibly have hold it in the hand and is connected by Bluetooth to a tablet, and those are as effective and efficient as a kind of a any clinical ultrasound machine in a clinical setup. But I'd say that our PCPNDT rules kind of discourage that kind of an equipment. But I'm just sharing where the globe is going, and maybe someday we might have to look at that avenue as well. We are committed to the training and skilling to build capacities for HCPs. I think through our CII Healthcare Institute, we have a various skill creation and skill enhancement programs, and we also have various trusted partnerships with reputed organizations such as Tata Trust, Narayana Health, Max Hospital, Columbia Asia, American Heart, Columbia University. So all I'm saying is that we are capable to help the ecosystem, help the institutions, and help the country and help the government in whatever path we choose collectively to go on. We also have a unique startup collaboration and mentorship program called as Edison X, where we look at startups in the healthcare space. We partner with them when we provide the best in-house AI, medtech, and versatile leadership capabilities, and we kind of mentor them. At the end of the day, we all work to ensure best health outcomes with superior patient and HCP experience for all. Undoubtedly, I think with the distinguished institutions such as CII and forums such as this, and with accelerated dialogues and discussions amongst relevant stakeholders and policymakers, I think we can help ensure a comprehensive and an actionable health care agenda that can take care of all of us, whether it's patient, providers, technology providers, payers, etc. And I mean, our belief is that we should be doing that in a mission mode in India. After all, health is important for all. Thank you. With that, I'll take a pause and hand it back to Mr. Nanavati.
Thank you, Amit. Appreciate the perspective that you provided. Before we sort of move to the closing comments, just as I did with the other speakers, I had two questions for you. One was, again, myself coming from an MNC world and you representing a large MNC, there have been a lot of issues about, and Dr. Thomas talked about the private-public partnership, which everybody has talked about. I'd like to understand what is a general view. I don't see, other than a few pockets like a GE or a Medtronic or a 3M, you don't see a large flow of international medical device companies. A common refrain that I've heard is, the price points do not make it attractive enough for us to operate in India. So it's sort of a very peripheral presence. What is the general feel that you have in terms of MNC healthcare players having an interest in participating in India, other than the few that I just named, including yourselves? Is India seen as an attractive destination for global MNC healthcare players?
Mr. Nanavati, I think pretty interesting and very intriguing question, actually. I'll put it this way. The thing is, yes and no. You have to have a mindset for this. GE has been in the country for almost like 30 years now as a Wipro GE JV. And we have been committed to this country, to the society here. And you'd also, and in your earlier avatar as a syndicate with Syndicate Bank, you'd also realize that anything when is evaluated on a business slate, it's about return on investments. while it's about human care and healthcare, it's ultimately looking at how far a particular rupee or a dollar can take you in terms of business objectives. Okay, so from that perspective, it becomes challenging. The I would say the per patient recoveries are pretty less in the public private partnership. But having said that, I think the volume kind of makes for it. And moreover, the way we have done it in GE, and we did it very consciously, was that a part of our investment mode, our investment thinking, had to be directed to something what I personally call as a through cycle investing. You can't be looking at a return like from a 1 year perspective, that this calendar year, this financial year, how much I'm going to make it. It's like I need to earmark certain part of my revenue, or certain part of my budget plan, saying that I'm going to invest in this, create that infrastructure, hoping that I might get a fair share of that increased pie. And I think that kind of an approach, what we have been taking at GE over all these years, I'll even say decade, I think has made us a very credible name in that particular forum. But if someone wants to come in and says that, okay, fair enough, I'm like I have the best technology and I have the best services, but you need to, but starts dictating terms in terms of what is best for the country and for the society or for the political government, I think that doesn't work. You have to work hand in hand, evolve a solution, and take it forward.
Thank you, Amit. So in the interest of time, we've got a couple of minutes left, and a few people have posted a few questions, which I will read out. One was, I think, addressed to Dr. Thomas about, is there any funding support for the projects on empowering elderly people? Dr. Thomas?
Yeah, actually, the government actually is very generous with the help to elder care, so we can access that. But having said that, via Vikas, the society which we formed has just started. We will be looking for funding. I hope that answers the question.
Okay. There was another question which I think maybe Shobana could respond to. I don't know if she's still on. Somebody has asked this question, that agree that technology will help us in overcoming challenges, but concern is hospital dealers are trying to loot people during the pandemic with significant price hikes for oxygen, masks, etc. How to tackle this? This is just a question that was posted out there, and I don't know if that's been happening. I know that eminent hospitals like you all don't do that and would not do that, just like companies like 3M and GE would not. But there seems to be a perception that there is some price gouging happening. Is that a fair comment, or do you think that's a
No, I think that in this desperate situation, there'll always be bad apples, and that's why I was saying that we must use the system to create, and the checks. Technology should actually be able to improve trust. So if you have it out there, just the prices are way more transparent. And the bigger hospitals, there's been no case at all that there was any price gouging, because one is that the government was very clear. It clamped down on many of the products. So during those initial days, definitely people would have. There are some bad apples, so we can't. But we can't just broad brush everybody, because these things cost. And if you look at it, because of the disrupted supply chains, all the prices have gone up in the world, of all medical supplies, and even the APIs of medicines all of a sudden have all skyrocketed. So who's to bear this? At the end of the day, we must understand that the world has gone through a significant health challenge, and there is significant inflation. To be able to think that you can reset at an old price or reset at something, I don't think is really fair. So I think, considering all this, and the people who have witnessed the pandemic, most of them are grateful. The people that have that are a bit disillusioned have a louder voice. That's all I can say.
Thank you, Shobna. The last question that was posted here, and it's more of a comment than a question. Somebody has asked this question about, I expected speakers should also have talked on moral and ethical aspects of healthcare service providers. Somebody has posted that comment, that there was an expectation that point of the moral and ethical aspect. And from my side, one additional point that I did not, which sort of in the back of my mind, has been the issue of data privacy. We haven't really touched upon data privacy. So again, this was more in the nature of a comment or a rather than a question. But if anybody has a view and would like to respond to that, we have a couple of minutes left. So
Oh, it's
please feel free.
fundamental, Ajay. It's fundamental, and
Yeah, if I may
that's where
come
I
in,
came
I
from
think,
in
yeah.
terms of trust. That's what I came in terms of trust, and I do agree. Data privacy will feature more and more. That that's why whether it's the government apps, we worry about these. The cyber security that are happening, and it'll just come to healthcare for sure. So we do have to be careful. That's why I think big investments, companies like ours, when we came up with an app, it hasn't been cheap. So out of the 100 crores we've spent, a significant amount has come towards building security layers. Because I think that one is that because of the brand being out there, you will erode the trust of everything. So we recognize how vulnerable we are in such a volatile world.
Yeah. Can I just
Yeah,
add
if I may
another
add,
data privacy?
Nanavati, if I
Yeah,
may
please, Dr. Thomas, go ahead, and then Amit, and then we'll
add,
have to wrap it
yeah.
up.
So I think when I spoke about quality, it was all encompassing, and ethics is very important. I just want to also say that we've been actually lobbying with the erstwhile MCI, and you may be happy to know the person who answered this question and all the others, that a module on communication and ethics has been introduced for MBBS graduates, all MBBS graduates, and also in the National Board of Examinations. So yes, very important, very crucial, and as it is the baseline of what we do. But as was mentioned earlier, there will be a few bad apples, but ethics is the cornerstone of our profession. Thank you.
Thank you, Dr. Thomas. Amit, I'll leave you with the last word, and we'll have to sign off.
Yeah, I'll quickly talk on the data privacy part. Uh, no, so look, the thing is that technology will always have its challenge, and it kind of gravitates onto the next level. But the way things have been doing, and most of the credible institutions, that they take cybersecurity as an extremely important aspect of developing and designing a product. And the way we have been, at least in G Healthcare, the way we have been actually deploying solutions in the field, we encourage institutions to have on-premises servers so that the data is secured with them. We provide the solutions. We encourage them to be a part of the cloud solutions only if they believe in it and they have a sense. And I saw one quick question on the maternal infant care thing: is the infrastructure good enough? I would say we are getting there. As compared to our care on the adult side and to some extent the pediatric side, I think the neonatal and the pediatric care requires good amount of intervention and investments from the infrastructure side.
Thank you, Amit. We continue to get questions being posted, but in the interest of time, I'm going to have to sort of close it down. So once again, on behalf of CII and myself, I really appreciate this very open, candid, interactive conversation. I think a lot of issues have been put on the table, and I think if this group regroups 3 years from now, and we can see what we all predicted and how it actually turned out. So in summary, thank you all for your time, and I really appreciate the forthrightness and the granularity with which you all shared your opinions. Thank you all very much.
Thank you.
Julian, I'll hand it back to you.
Thank you all for joining in. It was an insightful session. The audience had wonderful engagement as well with all the questions coming in. Pretty sure, as Sir said, yes, it's a panel which can be encouraged for the next few months as well for discussions and further more sessions. Thank you once again for joining the 17th India Innovation Summit. Thank you and have a wonderful day.
Thank you.
Thank you, everybody. Thank you. Thanks, everybody.
Also, I would request everybody if you could join the next session, which is scheduled at 11 hours, please.
All right.
Thank you.
Thank you.
Thank you.